Welcome all of you, my YouTube channel. This video I am going to talking about contraceptives. First of all, if you are not yet subscribed my channel, please subscribe it. If you have any questions, please leave a comment. Contraceptives, also known as birth control, are methods or devices used to prevent pregnancy. They play a crucial role in reproductive health, enabling individuals and couples to plan and space pregnancies, manage family size, and protect against sexually transmitted infections (STIs). There are various types of contraceptives, each with its own mechanism of action, benefits, and potential side effects. Types of contraceptives: barrier methods, condoms, thin latex, polyurethane or lambskin sheaths worn on the penis male condom or inserted into the vagina female condom. They prevent sperm from entering the uterus and are the only method that also provides significant protection against STIs, including HIV. Diaphragms and cervical caps, dome-shaped devices made of silicone or latex that cover the cervix to block sperm from entering the uterus. They are used with spermicide for increased effectiveness. Spermicides, chemical agents that immobilize or kill sperm. They are used alone or with other barrier methods, but are less effective on their own. Hormonal methods. Oral contraceptives. The pills containing synthetic hormones estrogen and progestin or progestin only taken daily to prevent ovulation, thicken cervical mucus, and thin the uterine lining, making it difficult for sperm to reach an egg or for an egg to implant. Contraceptive patch, a small adhesive patch worn on the skin that releases hormones estrogen and progestin to prevent ovulation and create similar effects as the pill. It is replaced weekly. Vaginal ring. NuvaRing, flexible ring inserted into the vagina that releases hormones estrogen and progestin over 3 weeks. It is removed for 1 week to allow menstruation. Injectable contraceptives. Depo-Provera, an injection of progestin given every 3 months, preventing ovulation and creating similar effects as other hormonal methods. Implants, small, rod-like devices inserted under the skin of the upper arm that release progestin over several years, typically 3–5 years, preventing ovulation. Emergency contraception. Morning after pill. Pills taken after unprotected sex to prevent pregnancy. They work by delaying ovulation or preventing fertilization and are most effective when taken as soon as possible after intercourse. Intrauterine devices. IUDs. Copper IUDs, non-hormonal devices made of plastic and copper that create an environment in the uterus that is toxic to sperm and prevents fertilization. They can also prevent implantation if fertilization occurs. Copper IUDs can remain effective for up to 10 to 12 years. Hormonal IUDs, devices that release small amounts of progestin, thickening cervical mucus and thinning the uterine lining to prevent sperm from reaching an egg. Hormonal IUDs are effective for 3 to 7 years, depending on the brand. Permanent methods. Tubal ligation. Female sterilization, a surgical procedure in which a woman's fallopian tubes are cut, tied, or sealed to prevent eggs from reaching the uterus. It is a permanent method of contraception. Vasectomy. Male sterilization, a surgical procedure in which the vas deferens, the tubes that carry sperm from the testicles, are cut and sealed. It is a permanent method of contraception. Fertility awareness, methods that involve tracking a woman's menstrual cycle to determine the days when she is most fertile and avoiding sex or using barrier methods during that time. This includes tracking basal body temperature, cervical mucus, and using calendar methods. Other methods. Contraceptive sponge, a small round sponge containing spermicide that is inserted into the vagina before intercourse to block sperm from entering the uterus. Contraceptive gel, a hormone-free gel that creates a barrier in the vagina to prevent sperm from reaching the egg. It must be used before each act of intercourse. Effectiveness and considerations. Effectiveness. The effectiveness of contraceptives varies by method. Long-acting reversible contraceptives (LARCs) like IUDs and implants have the highest effectiveness rates, while barrier methods and natural methods tend to have higher failure rates if not used correctly. Side effects. Hormonal contraceptives may cause side effects such as weight gain, mood changes, nausea, and increased risk of blood clots. Non-hormonal methods generally have fewer systemic side effects. Convenience. Some methods require daily attention, for example, the pill, while others are long-term and low maintenance, for example, IUDs, implants. Health conditions. Some women may need to avoid certain contraceptives due to underlying health conditions, such as a history of blood clots, breast cancer, or high blood pressure. Reversibility. Most contraceptive methods are reversible, meaning fertility returns after stopping use, except for permanent methods like sterilization. Protection against STIs. Only barrier methods like condoms provide protection against sexually transmitted infections. Access and availability. Prescription vs. over-the-counter. Some contraceptives, such as the pill, patch, and IUDs, require a prescription from a healthcare provider, while others like condoms and emergency contraception are available over the counter. Cost. The cost of contraceptives varies widely, with some methods being more affordable or covered by insurance, while others may require a higher upfront cost, for example, IUDs, implants. Cultural and ethical considerations. Access to and acceptance of contraceptives can be influenced by cultural, religious, and ethical beliefs. In some regions, contraceptive use may be stigmatized or restricted. Social and public health impact. Family planning. Contraceptives play a critical role in allowing individuals and couples to plan their families, reduce unintended pregnancies, and improve maternal and child health outcomes. Population control. At a societal level, access to contraceptives is an important tool for managing population growth and promoting economic development. Women's empowerment. Contraceptive access is closely linked to women's rights and empowerment, as it allows women to control their reproductive health and make decisions about their futures. Contraceptives are a vital component of reproductive health care, offering a range of options to meet the diverse needs and preferences of individuals and couples. Access to accurate information and high-quality contraceptive methods is essential for enabling people to make informed decisions about their reproductive health and family planning.